My name is Erin Colburn. I'm the Pre-Health Advising Coordinator for the College of Health Sciences here at Boise State University. It's my pleasure to introduce the University of Washington WWAMI. We have a student and one of the representatives from the University of Washington here to present some information about the UW program. Again, if you're here, even if you're not an Idaho resident or a Washington resident, this is valuable information. It's another opportunity for you to interact with somebody who's in medicine. I am going to give a chance to allow them to introduce themselves, and then they have a brief presentation, then we'll open it up for question and answer. Our purpose behind recording today is solely so that those who missed the presentation could get a chance to see it. So we'll be just recording the presentation part and not the question and answer. All right. I have with us today Dr. Michael Elder Waters. Why don't you go ahead and introduce to them your year in school, where you're from, where you graduated from which institution you graduated from, and a little bit about what you're interested in studying medicine now.
Okay, well, I'm Michael, not quite a doctor yet. I'm a third-year med student, and I went to the University of Idaho, graduated with biology, and I just finished up my surgery rotation, and I'm currently planning on going into either general surgery or orthopedic surgery. It's still kind of undecided.
Very cool. And then we also have a representative from the University of Washington, Chelsea Frisbee.
Hi, I'm Chelsea Frisbee. I'm a program operations specialist for the University of Washington in our Boise clinical phase office. So we do have two phases for medical students. The first is the foundations phase, which is up in Moscow, and the second is our clinical phase, which is our office is located in Boise, but students go all around the state. So we just kind of assist students with that and get to plan wonderful events like this with our local schools. And I think Michael's going to be the star of the presentation because he's going to be able to show you and tell you a little bit more about his experience in the actual process of getting to where he is, and also looking forward.
Great. And then we should have one more medical student who might be coming in a little bit late, but we'll take some time to introduce them once they arrive. I also wanted to give some thanks out to Mary Crowell, our director of our Student Services and Academic Advising Office, in support of this program. Hi, Mary. And then Shannon Kerr is in the office as well, but go ahead, Mary. Do you want to say something?
I just was going to say hi. Thanks everyone for being here.
Great. All right. Michael, you ready?
Yes, ma'am. Thank you.
Awesome. Questions that's been posted on the presentation slides is who goes to medicine? So why did you choose medicine, Michael?
So I chose medicine. It was kind of a long route for me where I wasn't sure if I wanted to do like veterinary medicine or human medicine or dentistry or like get my PhD and do research. And so I actually probably starting in high school started having those thoughts, and then did a decent amount of shadowing of all the different kinds of things. And slowly it was always kind of back and forth up until college, and I did some EMT stuff. And once I did that and kind of got into the field a little bit more, that's when I finally made up my mind that, all right, this is something that I'm going to keep shooting for, and I'm going to go until I can't.
Great. So some of the steps or some of the things that students might be thinking about, it sounds like, is whether they want to work with people or whether they want to work with people and animals, where they like to care about problems, where they might have some desires for leadership. So it sounds like those were all qualities that you really felt were a little bit more adequate for you.
Yeah, I would agree with that, yes.
So in terms of career choices, can you talk a little bit about the difference between secondary care and primary care?
Yeah, so kind of like what this slide shows, primary care is you're kind of the first line that the patients are going to see. So whether that's, again, pediatrics, internal medicine, or family medicine, pediatrics, obviously it's going to be with the kids. Internal medicine, that's more so, it says adults only, but that's more so I think of kind of like in the hospital, hospitalized patient problems. Whereas family medicine is like when you're going to the clinic, you're going to see a family medicine doctor. And there are outpatient clinical internal medicine doctors, but a lot of internal medicine doctors are more so in the hospital. And that's compared to secondary care, which is more specialized. So for me, I'm thinking surgery. So I'm never going to really be the first point of contact for any of these patients. Like when I'm here in the clinics, all of our patients have pretty much been referred to us. And a lot of times that's kind of how that works, except maybe not dermatology. A lot of dermatologists, just you go see your dermatologist regularly.
So in terms of career choices, it sounds like doctors can work in a lot of different facets, not just in what we would envision and what our thought process with those. Can you talk a little bit about some of the different areas that physicians can work?
Yeah, so I mean, I'm most familiar with academics and then just within the community medicine. And I would say in the academic side of things, there's a lot of opportunity for being in administration where you're either like I've heard of a lot of doctors being like the chief medical officer for something, for a hospital or whatever. A lot of doctors, especially at like UW, are also associate professors. And so they're doing research and they're also doing their clinical work, but they're also doing a lot of research. As opposed to being out, like right now I'm here in Wenatchee, Washington, and most of these doctors aren't doing research out here. They're just taking care of patients. They wanted to get out of the academic side of medicine. Basically, a lot of people in academics are also doing research. So you can see Dr. Fauci there doing a lot of research. I'm not super familiar with the other sides of medicine just because that's not something that I've been super interested in. I would say, yeah, again, things I know are like the academic side, the research side, and then the clinical side. But yeah, I mean, I guess you can go become an astronaut.
For sure. I would also say probably with what's going on in our world right now with the pandemic, probably public health is a bigger, there's probably more people that can maybe at least articulate what public health physicians might do or where they might work. So thank you for sharing. So tell us a little bit about the steps to becoming a physician.
Okay. So at least for me, my first thought of becoming a physician was in high school. And so this says K through 12, have fun. Pretty much you just need to be at a point where you can get into a college. And if that's like being a very good high school student, great. If not, college is the time to kind of kick it into gear. And I've heard so many people that wait until second or third year of college to kind of make that decision. But really, you pretty much need to be doing well in college from day one. And unfortunately, a lot of people freshman year kind of mess up their grades for later years where they're still trying to figure out what they want to do, but it's really hard to bring up a grade if it's been kind of bad as a freshman. So one thing that I was told, even in high school and very beginning in college, is if you're considering medicine at all, like try your best to make freshman year count, because a lot of people can, as you get used to it, you can kind of build your grades or solidify your grades as a sophomore, junior, senior. But freshman year is kind of what's going to change you from that like 3.5 GPA up to like a 4.0 GPA. So that's like academics in general. But then definitely it's recommended that you try doing something that gets you involved with the medical field. So for me, kind of I would say the three big ones that I hear of the most often are either becoming an EMT, becoming a CNA, or becoming a medical scribe. And I think probably you'll get the most realistic view of what medicine's like if you're a scribe. Because for me, I was an EMT, and you actually don't get a lot of exposure to the hospital. You get a lot of exposure pre-hospital, you get a lot of clinical experience. It's all really good. But if you're wanting to see how the hospital system works, becoming a scribe is actually a really great option if that's something available where you're at. And then for me, I also did research, and I know that can be kind of challenging trying to figure out what's going to happen. But like for me, I ended up emailing, I think, 3 different professors at the end of my freshman year and just said, hey, is there anything available for a little undergrad student like me? Like I'm willing to work. I'm willing to work for free. I just need some experience. I want to get into a lab. I want to see what's going on. And you'd be surprised how many people are willing to put someone to work for free. So yeah, I would say be open to things like that. And then this slide also says pre-med advisor. And I can't stress enough how important my pre-med advisor was to me throughout my 4 years. I would go visit her every couple of months, and she'd be like, all right, let's dial back in. What do you need to do next? And she was actually like my academic advisor, as well as my pre-med advisor. Like not formally, but I took her advice over what my academic advisor suggested, just because I trusted her so much and saw her so often. So definitely get involved with your pre-med advisor early. And then I'm in the medical school part of this. And at least for WWAMI, typically medical school is divided into 2 years of clinical, or not clinical, 2 years of book work and then 2 years of clinical. For WWAMI, for University of Washington in particular, it's 18 months of book work at the beginning, and then you get a couple months to study for step 1, and then it's into clinicals. And right now I'm in the clinical side of things, just finishing up my 3rd year. And then after that, it's residency, and you have a lot more training after this.
So how does it work? You started to talk a little bit about that. So the first step that you talked about was the basic sciences, which University of Washington performs in 18 months, yes, where you get to do those lectures and the work in the classroom, get to do some clinical exam history, and then you move into the clinical phase. So what was that like? So
for us, the first 18 months are, it's broken up into different blocks of different systems. So we started out with, what did we start out with? It was like we called it was basically just like cellular biology. It was a very basic biology with some influence of medicine, just trying to get us into that train of thought. And then after that, we went into infectious diseases. And then after that, we started doing systems. We did cardio, pulmonary, renal, GI, and then I think we did neuro and reproductive pretty much. But it was set up to where you're in the classroom for about 4 hours each day, and then you're expected to do some prep work outside of that. And we would have an exam every single Monday for the first year and a half. So it's like you're covering a lot of information really quickly. And I think of my undergraduate degree, it requires like 120 credits. And I think I did something like 140 credits in my 4 years. And that was considered kind of a lot. But then in medical school, in the first 18 months, you do like 150 credits. So like you're doing twice the amount of work in less time. But I mean, again, it's really cool because in undergrad, you always see, if you're doing biology or something like that, you're given a PowerPoint slide of all the different things that are going on, and then you have a tiny little clinical correlate in the bottom corner. But this, it's like the exact opposite. It's all the clinical stuff, and then a little bit of the refresher biology, which makes it actually really fun because everything applies, and you can see how it applies. And then after you finish that, so that's the first 18 months, you finish that, and then you have to study for step one. And step one, if any of you are studying for the MCAT right now, it's like studying for the MCAT on steroids. And it's just, it is pretty crazy. I mean, luckily, maybe unluckily, it's changing to pass fail, which has some different implications for later on in medical school. But I think probably for the better for mental health of everybody involved. But so that happens after the 18 months, and then you go into the clinical phase. And for me, that's kind of what I'm just finishing up. We get, I think there's 6 core rotations that you have to finish in your 3rd year. So for me, I started out with OBGYN, then did psychiatry, then pediatrics, then internal medicine, then family medicine, and finished up this year with surgery. And yeah, it's a lot of hands-on. A lot of the times previous to this, like in the book work or the basic sciences portion, there will be times when you get to work with patients a little bit here and there, but for the clinical phase, you're in with the patients a lot. And most of the times the doctors will say, all right, go see the patient and tell me what's going on and come up with a plan. And if you do it well, you are like an acting doctor in some of those situations. I had, for my internal medicine, one of my doctors was like, all right, you go in, you make up the plan. And if I like what you're saying, if I like what you're doing, I'm going to come in and I'm going to sign your note, and that's the end of it. And when that happens and you can finally see how all this work that you've been putting in over the last couple of years is starting to pay off, it's super fun.
Thank you. So I hope that you know what this all means in terms of the fabric of the University of Washington School of Medicine curriculum. So this appears to be what its purpose is and what they're trying to instill in you and integrate in you with everything that you do. How do you feel? Do you feel these are adequate values and things that you care about?
Is this directed to me?
I would say yes.
Okay. Yeah, I mean, these are all very important things. These are things we actually talk about quite a bit. I think the University of Washington is really good about things like diversity, about health equity. They're doing a lot of work to try to bring that to the forefront of medicine, because it is such it plays such a big part in medicine, and for the longest time we've kind of just ignored it. And so the University of Washington is saying, hey, let's bring that to the forefront, because that stuff actually impacts how we do medicine, how medicine affects people, how they respond to treatment, how they adhere to treatment. And so, yeah, all these things are very important, and you will learn a lot about them if you go into medical school.
All right, so I'll talk a little bit about this one. So in terms of cost of medical education, this slide kind of shares, or at least kind of emphasizes the difference between maybe a public school or with in-state residents, which the WWAMI programs facilitate for Washington, Wyoming, Alaska, Montana, and Idaho, and in comparison to maybe a private institution and what your benefits of those are. So this is information that kind of showcases some of those factors. Certainly, it looks like it's a cost benefits for you. Michael, do you feel like that was one of the decision factors in your choice at University of Washington?
Yeah, I would definitely say that it was. I think it's also, I mean, another reason I chose the University of Washington is because it's a very well-respected medical school. It's like always in the top 10. And so that played a huge part in why I wanted to go there. But I mean, you can't ignore the fact that you're going to be saving, for me, I would be saving like, again, close to, it's something like $15,000 a year compared to any other university, because I get in-state being from Idaho. And 15,000 over 4 years is 60,000. Like that's something you have to take into consideration. And yeah, a lot of people don't want to talk about money when you're going into these sort of things, but it is something you have to think about. You have to
Sure.
make the right move for your.
Sure. In your experience of applying to medical school, I assume that you applied to multiple medical schools, and in doing so, you had to factor in all of the different things that medical schools are looking for in applicants, whether it might be motivation and maturity or observation from a patient doctor perspective, understanding what leadership skills are. And you talked a little bit about those at the beginning and what you got to do and what you participated in. These are all things or skills, values, and information that you would need to be a good physician. Do you see any on that list, Michael, that you think you want to hit on that you haven't already? You talked a little bit about research and observation experience with being an EMT. Are there any others that you think might be also helpful for students when they're thinking about applying to medical school?
I would say that the things that I've seen would be pick one thing and just kind of stick with that. So for me, I did EMT for all 4 years of undergrad. I was like, I want to do this from the beginning and I want to see how it goes. And so by the time applications came around, I had so many good stories and so many new perspectives from doing EMT for 3 to 4 years. And so I think if you can pick something that you can just sustain, it means a lot more. You get better letters of recommendation. And because you're invested in it, you can talk a lot more about it. And so I actually found that every med school that I applied to was very interested in my EMT experience. And I think it was partially because not every applicant is doing EMT stuff, but also because it was a very big part of my life for 4 years. And so I would say if you can do something, whether it's CNA or EMT or medical scribe, and you can do it for a while and show that you can stick with something and show that it had a meaningful impact in your life, I think that's huge. And then I know other people did things like one of my friends, one of my classmates, she was really into gymnastics growing up. And so all through undergrad, she was like a gymnastics coach. And just that continuity of something that she loved and then brought to others, it doesn't have to be medicine in order for them to see that you're passionate about something. And so I would say that's something to keep in. Like for me, I played club volleyball, and some of the medical schools wanted to talk about club volleyball just because it's something you can do outside of medicine. It's something you're passionate about. And right now in medicine, like physician burnout is a huge topic that everyone's talking about. So if you can show that you do things outside of medicine, that is also a really, really great thing.
Awesome. All right. So what is it? What is WWAMI? Well, it's 5 states, Washington, Wyoming, Alaska, Montana, and Idaho. And each of the state legislatures and the University of Washington schools have affiliates. So in the state of Idaho, University of Idaho houses the 18 months that Michael was talking about in terms of the educational piece. So you get to go up to Moscow, Idaho, correct, Michael, and get to experience your didactic coursework there. And
Yeah,
each of the states, go ahead.
I was just going to say to that, I think maybe in the PowerPoint a little bit later it talks about this, but all the facilities at Moscow are like brand new and awesome. So we actually have like some of the best state-of-the-art equipment in all the entire WWAMI region. Like if you go to Seattle and check out the Seattle Medical School, it's poor quality and very old. And none of the Seattle students like their facilities. Whereas over in Moscow, we have all this great stuff and everyone loves it.
Very cool. So it's provided publicly to support medical education in those 5 states. It increases the number of primary care physicians in the state of Idaho, as I know it, and Chelsea, you can correct me if I'm wrong, but I believe we're ranked 49th for patient to physician ratio in the US. So this is a purpose is to try and remedy that and then provide community-based medical education, expanding the graduate medical education to residency training. I believe in the presentation, it indicates which residencies we have in the state of Idaho and in the other WWAMI states. And then it also provides it in a cost-effective manner. So this is the WWAMI program sitemap for all 5 of the WWAMI states. And if you look and notice, there are little red blips and green blips, and all of those things are locations. And so in terms of the green blips, those are the rural underserved community or the RUAP programs. There's some ones that have T's on there. They kind of, it's a pretty big map there in terms of kind of all of the different things that you can do. So Michael, as I understand it, you're in Idaho. Are you Idaho tracking for your clinical rotations?
No, I'm doing the safari.
Oh, you're safari. So can you explain a little bit about what safari is?
Yeah, so for 3rd and 4th years when you're doing clinical rotations, and this is very specific to the University of Washington, like no other school does this, but because we have a 5-state region, you can choose to either track somewhere, which means you're going to stay in one general location, or you can do a thing that we call the safari program, where you can kind of travel around the entire 5-state region. And there's kind of incentives for each one. So a lot of the people in my class have families, and so for them, they want to stay in one general location. And so for them, doing a track in one state makes sense. So you can do like an Idaho track where you're going to stay, most people stay generally in like the Boise area, but you also end up going up north to as far as like Sandpoint and maybe even Bonner's Ferry. I'm not sure about that. But generally you're staying in Idaho as opposed to traveling all around. So if that's your decision, you get prioritized for everything in your state. But that's kind of the limit. Whereas for me, I knew I wanted to do surgery kind of coming into 3rd year. So the way safari works is they say you get one pick that is like your top pick, and you're almost guaranteed your top pick in your specialty of choice. And so for me, I picked safari so that I could pick where I wanted to do surgery at. And I picked surgery in Wenatchee, Washington, kind of for several different reasons. I'd heard very great things about the doctors here. Also, kind of weirdly enough, Wenatchee picks up like 1/3 of all of the Washington patient population. Kind of the western third of Washington goes to Spokane, the middle third of Washington goes to Wenatchee, and the middle third goes to Wenatchee, and the western third goes to Seattle. But for me, I'm doing this safari program, and so I've been all over the lower 48 4-state region. So I started out in Bellingham, then went to Seattle, Washington, then went to Cheyenne, Wyoming, then went to Twin Falls, and then to Boise, and then up to Whitefish, Montana, and now currently in Wenatchee. So depending on what you want to do, you can either travel around all over the place, or you can kind of stay generally in one location.
Great. And we have the wonderful Ben Showalter, who has been able to come in and join us, and he is a 3rd year WWAMI medical student. Hi, Ben.
Hey, sorry, I was muted there, but yeah, I was in a meeting. Sorry, I'm late.
That's okay. We're so thankful that you could come and talk. And I know that this is kind of one of those weird situations. You guys are switching your rotations this week. So I appreciate your guys' time, and I'm sure all the students do as well. Would you be willing to kind of share real quick which institution you attended your undergraduate, what you majored in, and which rotation you're doing? Are you doing it, like which track you're doing?
Yeah, so I did my undergrad at TCU in Fort Worth, Texas, which is by Dallas, and was there for 4 years. Then did scribing with a medicine doctor for a year in Fort Worth, so I was there for a total of 5 years. And then in terms of where I am now, I'm doing the safari track for my rotations. yeah, and have been all over the place. But I just came from Great Falls, Montana, doing outpatient medicine, and now I'm starting pediatrics here in Boise. So
Great. Well,
yeah.
very exciting. Thank you for joining us. We're just about finished with the presentation, so we're just kind of going through. We were just talking a little bit about rotations.
Okay.
The other thing I wanted to mention to the students, or at least share, is so the yellow stars on the map. So if you look up at Moscow, Idaho, or Seattle, or Spokane, those are the sites where they have their didactic or their 18-month education. And then the WWAMI regional clinical offices, they're located all over, but the Idaho one is the Boise area. And then they mention over on the legend, there's the blue ones, which are the required clerkships. And so if say you're an Idaho tracker, your clerkships will be located in those blue dots. And then those advanced patient care clerkships and the residency rotations, those are located in the red. Okay, all right. So as Michael was mentioning, state-of-the-art building in the University of Idaho WWAMI program medical education building. So Gritman Medical and Anatomy Lab. Those are all new, brand new, spanking new buildings. You mentioned that you were pretty proud of those. And yes, so you want to talk a little bit about those, like the Anatomy Lab and some of those things?
Yeah, so Gritman's kind of the hospital that Moscow uses. So we kind of use the Gritman building in Moscow. We also use St. Joe's down in Lewiston, but in Moscow specifically, our facility, at least the anatomy lab and our kind of one classroom facility is located right across the street from the Gritman Medical Building. And in there you have one classroom, and you have this state-of-the-art anatomy lab, which is made for the 40 students. So they have, Ben, do you remember, is it 10 or 12 cadavers that they have there?
Yeah, I think it's 12 if I remember correctly.
I think it's 12. Yeah. So then that's all right across the street from Gritman. And then a couple blocks away, they completely renovated the medical education building last year, and it's now all kind of state-of-the-art stuff again. And I don't know how many classrooms are there. There has to be like 4 or 5 classrooms there, with a bunch of study breakout rooms and just nice common areas. It's all very nice and new. So if you have anything to add, Ben.
No, yeah, the building is super nice. I mean, we just got the tail end of it, so it's kind of in construction phase still. So, and I haven't been there since, but seeing the tail end of it and what it looks like is super exciting for medical students, because it makes it easy to go study and stuff with those. You know, they have that big window pane presentation. It's just really, it's a fancy building. So
yeah, and it is probably the newest and maybe the nicest in the WWAMI region right now.
Right. So this is a little bit bigger blow up for just Idaho specifically in terms of those things that we mentioned in the clinical rotation and exposure. It sounds like both Michael and Ben are doing safari, which means they get to play with all of the 5 WWAMI states, but a lot of students will opt to stay in the state of Idaho. And these are some of the locations that they would clinically rotate towards. So there's just some kind of fun things, and I'm curious and interested to hear from you both. What are some of the fun things that you've done? I know it's not all work, there's play. So maybe you could share a little bit about some of the activities, some of the actions or opportunities that you get while you're in the WWAMI.
well, for me, I love biking in the summer and skiing in the winter. So that's been awesome in safari, because you get to go explore all these different places around the area. For instance, I went to a resort in Great Falls like 3 times while I was doing outpatient medicine, and been doing biking and stuff in Wyoming, which I would never have done normally if a rotation didn't pull me over there. So that kind of stuff is super cool. Plus, you just get to see new cities and territory that you otherwise wouldn't get the opportunity to go see. So yeah, it's pretty neat.
Awesome. All right. So these are just some additional resources for you all to be aware of. And then that was the presentation part. So I am going to turn it over to you, the students. You are free to start to ask some questions. It would be nice if you maybe use the raise hand so I can keep track of which order we ask. But these lovely medical students are happy to share their experience.